They're all about making money. If you knew a person like that, you would shun him. You'd think, God, what an awful person. Well, you're interested in his money. That's your average company. And they will screw over anybody they have to get that money. They're psychotic. Okay, I mean, I get it. You really want a psychotic in charge of your health care? That's what we're at now. That's what we have. That is how we have set things up. And we can't get rid of these guys because, well, when Obamacare was on the table, we bargained away the store. Not only did we take the public option off the table, but we allowed the private sector to play a greater role in the delivery of insurance. And once the insurers had gotten this for themselves, and once their Republican friends had gotten the mandate that they were looking for, and it was their idea, then the Republicans all left the table and said, we're not going to vote for that, screw you. We got hosed in this deal. We gave up everything in that negotiation and got nothing. And now we're in a situation where the Republicans are holding the Affordable Care Act over our heads as if it is some cudgel that we handed them and said, beat us silly, please, because we're too stupid to know. When in reality, the Affordable Care Act is not perfect. It does precious little in bringing down the cost of health care, which is a huge part of the problem. There's no question about it. It does very little. But that's not really what it's trying to do at this point. Baby steps. As the Affordable Care Act is designed at this point, its main purpose is to try and address the 50 million uninsured. And so anybody in the conservative camp, any critic of the Affordable Care Act who says, this law is terrible because you're still going to pay an arm and a leg anytime you have to get an MRI, this is someone who doesn't get it. This is not what it's not what Obamacare is trying to do. It's trying to get more people insured, trying to get that risk pool enlarged like we talked about. And then it takes a few tentative steps towards cost containment, such as a new emphasis on wellness, for example. New incentives for doctors to reward them for keeping you well as opposed to rewarding them for ordering every other test in the book. That's there. But there's so much more that needs to be done. Arguably, we've squandered opportunities to take big steps towards addressing this because obviously a public option would have been the camel's nose under the tent. Some people would have been signing up for it, and before you know it, everybody would have been signing up for it because the private sector couldn't compete with it, quite simply. It would have delivered insurance more effectively and more cheaply than the private sector can do it. And there will be those who say, that's socialism for you, and I say, so what? There are some things that the government is supposed to do. When I get a glass of water out of the tap, I want it to be clean. And I don't think there's any corporation that's going to do that. When I go to supermarket, I want my food to be safe. And I don't think that's something I can trust the private sector to do either. When I get into a car, I expect there to be seatbelts. I expect there to be airbags, which Detroit fall straight down the line. When I go to the bank, I expect there to be certain regulations there to protect me from their rapacious behavior. This is regulation. It is good. It's called rules to the road. It's called parental supervision. Why is healthcare any different? It's not. It's not. And that's what's so frustrating here is this idea that the marketplace is somehow going to regulate itself, which it won't, which it has never shown itself to be capable of, at least as far as healthcare is concerned. And as a result, things get worse and worse. Medicare is projected to be running a $30 trillion deficit over the next 75 years. That's a number so big, I can't even get my hands around it. That makes Social Security look like one of my kids' video games. How we are going to address the problems with Medicare, it's beyond me, unless we create a Medicare for all system and our problems disappear overnight. Because young people, healthy people, enter the risk pool and costs come down. They have to come down because that's how it works. Rather than insuring nothing but old people and disabled people. We'd be insuring healthy people. That's how the game gets played. So, in sum, before we take some questions, am I pessimistic that we will ever have change? I mean, you've heard me rant and rave up here. No, I believe that there will be change. I believe that sooner or later we will get to a system that is equitable and fair and affordable. One that is predicated on the idea that health care is a right and not a privilege. But to get there, we're going to have to melt down. We're going to have a crisis of unimaginable proportions before our lawmakers will throw in the towel on all their ideological rhetoric and say to themselves, you know, we got to do something. The house is on fire. We will get there. But a lot of people are going to get hurt in the process. It's unnecessary. It's uncivilized. But it's the American way. Thank you very much. And I'd be happy to take some questions. This.
Yes, I'm one of the older, not disabled people, and I'm on Medicare. What is going to happen to Medicare once Obamacare is
She wants to know what's going to happen to Medicare once the Affordable Care Act kicks in. No, you're not going to lose anything. When the Republicans talk about cuts to Medicare, they're talking about cuts to reimbursements to doctors, which the doctors and the hospitals have already agreed to because more people will be coming in because of the tens of millions who will now be insured. So the hospitals are rolling the dice and figuring, just like McDonald's, volume is going to make up for the low cost of that quarter pounder. And that's why hospitals agreed to this. You lose nothing. Moreover, Obamacare closes the donut hole. And you should be thrilled about that, because the donut hole for prescription drugs is insane. Moreover, the entire prescription drug benefit passed by George Bush was unfunded, which, thanks. And so Obamacare takes steps towards funding the benefit. It's an important benefit, to be sure, but when the Republicans gave it to us, like a Christmas present, they didn't even bother paying the bill. So now Obamacare addresses that. Will there be changes to Medicare? Of course there will. And will there be higher rates? In other words, premiums? Yes, almost certainly, because it's unsustainable in its current system. But rather than reaching deeper into the pockets of seniors, which seems to be what the conservatives are content with, or privatizing it, which is nuts, the answer, as we've been talking about, is bringing healthier people into the fold and letting them share the burden. Because unless a young person was born on Krypton, they will need health care at some point. It is a fact. And therefore, they can get into the system. Thanks. You're the one. Okay.
It has 25 different languages. One envelope can have 4 big figures. What a total colossal waste. And another thing is, after usually all of a sudden here's for income. And really they're saying, oh, hello. Now, we would like to help you choose all kinds of things and help you with all the work. How do you?
That is the Affordable Care. So what she's talking about is, first of all the languages that are in the bills. What are you going to do? It's America, What are you going to do? So it's in Tagalog. So it's how it's going to be. All right. Hate to say it because it's not my favorite system, but if you want to ask a question, they're going to want you to line up at this microphone. So if you don't mind, please do, and I'll try and keep them moving fast. In answer to your other question, which was about, remind me? Right, they're calling you up. And the reason insurers are calling us about this thing is because there's a component to Obamacare that introduces wellness. Insurers and hospitals will be rewarded for keeping us better. And so they want to be proactive in addressing our healthcare needs. And they have every reason to, because what is the latest figure? Something like 60, 70% of American adults are either fat or obese. I mean, they have every reason to want to be intervening in our little lives. And that's what's happening there.
Made it seem like it was not Obama's choice to drop the public option when David Kirkpatrick in the New York Times clearly wrote that Obama made a deal with the for-profit hospital industry to drop the public option, just like he made a deal with the pharmaceutical industry not to allow them to negotiate with Medicare.
Right, and I said as much. I mean, that was the deal, was to get them to the table.
So
he had to drop the
and
public
then Nancy Pelosi did not put it into the reconciliation bill because there were 51 senators who would have voted for it. I followed this really closely.
I guess so.
Yeah, because, you know, I've been for single payer even before I got cancer, and basically I've had to stay separated, not divorced, for 12 years because I need I guess he is my health insurance. And he's now kicking me off in January when Obamacare comes, online, because, I have this pre-existing condition. So my question, which is a very self-interested question, is, I know that they're not going to be able to deny me coverage,
right, but
am I going to have to pay more because I'm a cancer survivor?
No. Under Obamacare, anyone with a pre-existing condition will not pay more for that. I won't pay more, you won't pay more. We both have pre-existing conditions. Obamacare, A, no one can be turned down. B, no one can be charged more because of an existing medical condition. Period.
Well, that's good.
Mazel tov.
Do you know why Vermont is not doing it, even though they passed it and the governor signed it?
I honestly don't follow Vermont that closely. I don't know if they read my column, so I'll take a look. Hi.
This is a short question. You mentioned at the very end of your talk that you imagined a scenario where eventually things get so catastrophically horrible that it would have to be changed. Things are so catastrophically horrible right now. I'd like you to elaborate on how you envision this horror.
The horror, well, unfortunately, what is the figure? Something like 80% of Americans still get their insurance through their employer. And so that stabilizing element creates a placebo effect, whereby the average American says, well, I'm covered, it's not my problem, I'm good, little realizing that their employer is going to keep turning the screws, passing along more and more of the costs to the worker in the form of higher premiums and higher deductibles and higher copays, and yet the employer will continue to reap the single greatest benefit of the system, and that is they can hold you hostage because they are the conduit for the coverage. So they've offloaded all of their burden to the worker and maintained the benefit for themselves. I mean, it's evil. It's like Kafka suddenly. And because so many people continue to benefit from our existing system, it makes change slow. And what's going to happen, I think, is healthcare costs will become so high that more and more employers will offload their people into Obamacare, into the exchanges. The exchanges will start taking them on, and then we will gradually start seeing that the exchanges aren't designed for this. It's not single payer. It's this government-run Turkish bazaar where the private sector is duking it out, and that's not efficient, and then cooler heads will eventually prevail. It's going to be a while to get there.
Hi. I told some people to come.
Louder.
I told some people to come this evening so that they could have affordable care explained to them, Obamacare, another term. And there are so many questions about affordable care that I wish you would tell us about. For instance, the different health insurers, which is the most reasonable, and if there are no such things as reasonable, What do you recommend as a good health insurer? One thing I read about HealthNet, that they won't have as many doctors as the other
saw
health
this
plans. Now,
Let me step in on that. Okay.
Okay,
Now, the question pertains to what do I recommend, and I'll tell you right now I'm not going to recommend anything because it's too early in the game. Now, we've seen a number of plans that have been put on the table. There are various moving parts. It depends on your age. It depends on where you live. There's things that apply, but what we do know is that the plans that have been put on the table under Covered California, which is our exchange, are much lower than had been previously reported by the doomsayers. We know that in New York, people are going to be looking at 50% rate cuts. So we know that these exchanges are delivering the goods. As to what plan you should have, I couldn't tell you. Pre-enrollment begins October 1st. The exchanges go into business January 1st. There will be a lot of resources to help hold the hands of all of us as we start picking our way through this new marketplace. So the best I can tell you is, first of all, read the LA Times. Second of all, go to websites like Covered California and other such resources where a lot of what's going to be laid out will be laid out in plain English, thank goodness. And we'll talk about what different people facing different scenarios should be thinking about doing. This isn't going to be advanced trigonometry. This is going to be a step-by-step process that hopefully will be no more painful than opening a checking account. If it's not, you know where to find me. You call me.
Thank you for a very lively talk. I have a comment and a question. Several of my physicians have dropped out of Medicare because they said the reimbursements are not sufficient. Dermatologists are the most common, but my eye doctor dropped out. So maybe it may be that doctors will drop out of these systems and only go to private people who can afford it because they're not going to get their reimbursement. So it's not so easy. The second, this is really a question. You said lots of young people will be coming into the system and college students, but we know that the biggest crushing debt people have now is student loans. They won't have money to buy insurance. They may be healthy. Then large numbers of them aren't finding jobs anywhere. So this notion that the young people who are coming up are going to save the system is very.
Let me get at the various components of that. First of all, there was the question of doctors dropping Medicare patients, not so much Medicare patients as Medicaid patients, Medi-Cal. I know they're doing Medicare too, but they're dropping Medi-Cal patients, a lot of them. They're dropping Medicare patients as well because Medicare is paying them a reasonable rate. Doctors will tell you that it is unreasonable, that it is not fair, they're not getting enough. And believe me, I've talked to my endocrinologist about this over and over and over. You should hear the fights we have. Look, these guys do not need to drive Bentleys. These guys do not need mansions in Brentwood. They are doctors. They are serving society. That's what doctors are all about. I mean, if we paid egregious sums to people who help people, I'd be the millionaire in the room. I'm not. So I don't shed a lot of tears for the 1% when they have to, economize a little bit. Now, I don't mean to slag off on doctors. And I know we got some doctors in the house. Please. And are you telling me that you cannot deliver the service you deliver under the reimbursement rate that Medicare gives you now? You can't? You would lose money? Then you find a way. I mean, what can I tell you? Okay, and I don't mean to be insensitive to a working stiff, and I got a lot of respect for doctors keeping me alive, but Medicare isn't perfect, but these guys have looked at what they think are reasonable rates, and those are the numbers that they've arrived at. It would be better if all of us were covered by Medicare, because then Medicare could find equitable rates that apply to all of society. As it stands, Medicare has a very limited data pool upon which to draw to make these decisions. So are they making good decisions? Well, it's garbage in, garbage out. They need better data to make better decisions. What was the second half of your question?
The notion that
the student, right.
save us.
And when I mentioned that, I talked about the ideal, that if we had Medicare for all, it'd be us, but it would also be young, healthy, immortal people in the pool with us. Now, sure, student loans are a problem. In fact, the American people owe more in student loans now than they own in credit cards. So, I mean, it's a big amount of money. So what? You got to be covered. I mean, you got to be covered. And we can afford affordable rates for people if everybody is covered. And so the trick is you got to get the healthy people in there with you. The way Obamacare is currently set up, it's not enough. The teeth that make you have to have insurance, not enough. Many people will dodge insurance because the tax penalty is just a few $100. So we need real teeth, but what we need is a system that doesn't require you to pay in. It requires a single payer system whereby it's coming out in your taxes.
But suppose you're out of college and you can't find a job. What do you do without health care?
And things get better. I mean, things will get better. You're kind of going off into the weeds a little bit here, worrying about...
Okay.
But I'll talk to you after the thing. We'll talk some more.
I am someone with Asperger's syndrome. I saw the movie ago, and that's Asperger's is denied in the health insurance. I am learning to be less extreme. However, I'm just thinking, why all this talk about social healthcare should be a right, like you said, and if conservatives aren't evil, then how is it that someone who's good, how can they see nothing wrong with someone who can't afford it, just letting them be sick and suffer and die? I mean, you have to be kind of crazy or not so nice and evil to think that.
Vote Republican, folks. You're making an excellent point. Two things. First of all, in Europe and Asia, healthcare begins as a right, and all subsequent conversation stems from that philosophical underpinning. It is a right and not a privilege, and now we will create a system whereby everyone can partake in that right. We don't do it like that. So that's our first problem. I want to give conservatives the benefit of the doubt. I don't think these people are evil. All evidence to the contrary notwithstanding. But that said, they are so beholden to their sources of money. And their sources of money tell them, we don't want to see significant change to the system, because anytime you have an industry that accounts for $3 trillion in spending, that's a cash cow you do not lead out the door. So and that's our problem.
So but how could they not see anything wrong with watching people die and letting them be sick?
Because it's nobody they know. I hate to say it. The Republican Party is trying to cut food stamps by $40 billion over the next decade. Why? Because they don't know anybody on food stamps. I mean, imagine that. Today...
But if they don't know, so if they don't know, they think it's fine to be inhumane?
Yes.
And evil like that?
Yeah, and I don't want to paint them all with such a gross brush, because obviously, you know, there's always different types.
Then whoever's telling them on Fox News must be really evil to
Okay,
that.
I'll talk to you after the thing. Thank you for your comments.
The Commonwealth of Massachusetts has something very close to universal health care.
They do.
So does the state of Maine. Since we have Democrats in the legislature and in the governor's position, what are the chances, do you think, of California having universal health care at the state level?
It's a great question, and I'm a believer that we do it the way Canada did it. Canada did not roll out single payer across the whole country. They did it province by province. That's the smart way to do it. You create a laboratory in a limited place, see how it works, troubleshoot it, and then you expand it and you troubleshoot it some more. That's exactly how you do it. So I believe California should be the nation's lab rat when it comes to single payer. Here's the problem. Here's the problem, and Sheila Kuehl and I got into a really interesting discussion about this. Sheila's great, but I asked her, all right, well, if we create single payer here in California, what do you do about Medi-Cal? Because Medi-Cal is funded by the state and the feds. How do you do it? Moreover, how do you handle Medicare, which is funded exclusively by the feds? Yeah, but you need to find some way to, especially for Medi-Cal, to accommodate the funding lapses that will come. It really isn't that hard. You just need Congress to play ball. Congress needs to adjust the stream of federal funds coming into California so we can experiment with a single-payer system. But until you do that, until you address the federal funding, our system doesn't get us there. It is doomed to fail from the get-go. That's the Achilles heel of us setting up a single-payer system in California without congressional support. And that's what we need to do first.
My question was, if you're
Raise the mic.
if you're a part-time worker, like most of us in the restaurant business, I have 2 jobs and I work about 20 hours a week at each.
And neither one of them gives you health care, right?
They haven't mentioned any. No, neither one of them gives
Of course.
health care. But I'm wondering if I would be covered and how many hours you do have to work to be covered through your employer.
The answer is yes. You are covered. You will be able to go to the exchange and you will be able to select a plan that works for you. You're young, I'm guessing you're healthy, so you're not going to need the gold plan. You can go for one of the plans that will have a higher deductible because you basically need catastrophic insurance. God forbid you get hit by a bus after this. You need insurance for that.
Or something like
Right, yeah, but you need that. If you trip and fall and break your toe, you can cover that. You're okay. You need something that can deal with that. That will be offered. It will be offered at an equitable level. And the whole idea of Obamacare is exactly for people like you who fall between the cracks, who do not get this benefit from their employer because you're working 2, 3, 4 jobs, none of them having enough time to be giving you benefits. And so they're basically working you like a wage slave and giving you precious little in return. It's like being a sharecropper. And it's, you know, that's the one of the primary flaws of our employer-based system is people like you who are working really hard don't reap the benefits of it, and until now, you got nowhere else to turn. Obamacare will address that. Pre-enrollment begins October 1st. I strongly recommend that you look at one of the lower tier plans that will have a high deductible but still give you the catastrophic coverage that you need.
Thank you.
And I wanted to point out that you have to say one about and that we need to
Hi, I want to thank you so much for being here and answering our questions. I have a personal question. I worked for LAUSD, and I had to retire before I could get my 80, which would have given me health care.
Wait, you don't get health care through CalSTRS or anything like that?
No, I retired a little bit too early because I couldn't stay.
Okay.
And so I don't have any coverage. I have a condition. It's possible that I will need an operation.
Can you wait till January for the
That's what
operation?
I'm trying to wait till.
I hate to say it. I mean, it's evil that you got to play beat the clock and hope that you don't get mortally ill over the next 2 or 3 months.
So I could register October 1st
Yep.
and then wait till January.
January
for the
1st.
procedure.
Yep, that's it exactly.
That's the best way to do it.
unfortunately, it might be the only way to do it. Keep yourself very healthy, eat well, fruits and vegetables, no strenuous activities. I mean, I'm serious, man. We're being glib, but I'm serious. I know a lot of people who are in the same position as you, who are basically watching the calendar, trying to make it to January. But when that happens, your pre-existing condition will not be a factor.
So October 1st, I can
Pre-enroll.
pre-enroll, and then I just have to wait. And January 1st.
Boom, doctor time. Good luck.
You had mentioned in some of the other developed countries there's a basic humane level of coverage, and people who can pay more get better coverage. Is there certain diseases that don't get addressed, or what is the difference?
Well, I can't tell you whether every disease is going to be covered by every plan. It's still the private sector, and these guys are still looking to cover their ass. So they are not going to say, bring your disease in, we'll fix it. They're going to be just as much of a bunch of schmucks as they ever were. It's just that now they can't turn you away at the door. So, that ratchets down the schmuckiness just a little bit. But, it's still these same guys. It's not like they woke up and said, by God, we've been wrong all these years. How could we be that like that? So, not every condition, not every treatment, not every drug will be covered. Moreover, it'll be the same thing where some drugs will be on a certain tier, some will be on another tier. Some plans will allow you to get one drug cheaply but not another drug. That's going to continue because that's the way these guys make their money. One day it'll change. Thank you.
Basically, I agree with everything you've said. I've been a single-payer advocate for many, many years. But the big problem, and I'm saying it firsthand, is the government doesn't do things very well.
You noticed?
Yes, they do not. And an example is if any of you have Medicare and you need durable medical equipment, you're up the creek.
Yep.
Okay, because there's something going on called competitive bidding for durable medical equipment, which has just eliminated some of your favorite and best providers and cut the prices to unsustainable levels and made access very, very difficult.
And remember when I talked about how things are going to have to reach crisis proportions before we fix them? This is one of those examples.
This is exactly what's going on.
And this is an example too. People will die as we work our way there. I mean, I'm wearing durable medical equipment right here.
That's right.
And it's, when people aren't able to get access to these things and they die, that's when things are going to improve.
Yeah. Diabetic supplies have been cut by 72%, and they're only mail order now.
I know.
Okay, so I personally, I have my own small durable medical equipment supply company, mostly treat people who have sleep disorders and provide non-invasive ventilation to people with neuromuscular disorders, like we have a lot of ALS patients. And I don't know if I will be able to stay in business.
I know, and
the company down the street got that contract. They've never done this before. They don't know what they're doing.
And
they're turning
we
people
will work
away.
our way there. I'm happy to talk about it afterwards.
Okay,
a little more with you.
You mentioned that the administration got buy-in from the hospitals because the hospitals looked at the plan and said, oh, look, you're bringing us lots of new patients. Drug companies, no negotiation,